there, my name is Dr. John Cathcart. I am from the School of Health Sciences, Ulster University. I am the Global Engagement Lead for the School of Health Sciences and a diagnostic radiographer by background. I have actually been to Regis College twice. I loved it, and I intend to hopefully come back at some point in the future once this pandemic is over. I'm going to talk about the health structure in Northern Ireland just briefly, and then I will then lead on to clinical placements and how the pandemic affected the students. The Department of Health controls in Northern Ireland controls the health service in Northern Ireland, and it's divided into two main sectors. The primary care sector, which is made up of health centres who have general practitioner medics working in them along with other professions. These medics come together in groups and work within the health centres. And when we have nurses, occupational therapists and physiotherapists also working these centres along with health visitors. On top of that, then we have what we call the acute sector, and there are 6 healthcare trusts in the acute sector, 5 hospital based, and the 6th one is the Northern Ireland Ambulance Service. Every person in Northern Ireland when they're born is given a health and care number, and they're also allocated to a GP service in a health centre within it, and they stay there or move to another geographical location. They move to another GP centre when they move. So therefore our health is there. It's free at the point of source to all persons who live in Northern Ireland. This is a map demonstrating the 5 trusts in the hospital sector. The yellow is the Western Trust, the orange is the Northern Trust, the purple the Belfast Trust, the green the Southeastern Trust, and the pink the Southern Trust. Interestingly, the yellow, which is the Western Trust, has the lowest population density, whereas the orange has the highest population, and Belfast would have the highest population per distance moved, as it is the capital and the main centre of Northern Ireland. But so, as you can see, therefore, we cover cities and we cover rural areas in quite a small, compact region. This shows the 5 trusts and the main hospitals within them. You can see here that we have Altnagelvin Hospital up in Londonderry. We have the Southwest Acute Hospital in Omagh. We have Daisy Hill Hospital in Newry, Craigavon Area Hospital. And here we have the Belfast City Hospital and the Royal Victoria Hospital, the Ulster Hospital over here, Antrim Hospital, and what is called the Causeway Hospital up in Coleraine. Within the sector we have different definitions. So the black is rehabilitation centres and minor diagnosis, limited diagnosis services such as diagnostic imaging. The red all have A&E departments. The blue don't have A&E departments, but they might have a minor injuries department. Whereas then on top of that, the red are sub-split into what we call the big 6, and they are Altnagelvin, Antrim, the Royal Victoria, the City, the Ulster and Craigavon, and they provide a full range of services to the population in Northern Ireland. The Department of Health also control the number of students that we recruit, because they fund the students, and that's worked out by workforce planning on a rolling basis. And they control the students for diagnostic radiography and imaging, occupational therapy, physiotherapy, podiatry, radiotherapy and oncology, and speech and language therapy, and they all are part of what's called the Health and Care Professions Council Register in the UK. And Health and Care Professions Council, the HCPC, also ensure that our courses mean that our students come up to standard and are competent to be their names to be added to the register, and that is quite important near the end of their degrees. Health physiology and healthcare science is controlled by a different regulatory body, and their places aren't funded, but they sit within our school because they're closely aligned to the other professions. What happened at the start of the pandemic, when it really hit last March in 2020, was that we fast-tracked final years. What that basically meant was our occupational therapy, our physiotherapists and diagnostic radiographers were fast-tracked onto a new temporary register of the Health and Care Professions Council as soon as all their clinical assessments have been passed, and that was so they could come out, they were nearly ready, and that was so they could come out and support the practitioners in practice and backfill and help where pressures were building. This was all prior to graduation. As soon as they graduated, they could then apply to join the permanent register, and they joined the permanent register at that point. But it was optional. You don't have to join the permanent register, you don't have to join the temporary register, but you couldn't work as one of these professions unless your name is on these registers. The other professions, apart from the three that I've mentioned, carried on but left placement early if all clinical assessments had been complete. And so it was we were moving the goalposts and moving around. It was very, very different, and it worked in the end. And then how we recruit onto the permanent register and how they get jobs is done on a regional basis as well for all our professions. So you go to one interview, and that could be for anywhere within Northern Ireland. You then record where you want to go, and then you wait to see if you get offered a job, and you join a waiting list. The diagnostic radiographers this year have all got jobs, which is great. The impact on years 1 and 2 was slightly different in that their placements were delayed. So if they were on placement, they were removed from placement. If they were about to go on placement, those placements didn't start. And we had to reorganise once easing in pressures over summer and autumn. So basically we were able to start putting people back onto placement from the beginning of August. And then if students had missed out in placement, we had to recoup it. So teaching was rearranged, compressed, lectures removed. So instead of starting semester 2 teaching at the end of September for some students, we started it in the first or the second week in August so that we could get them taught so they could go out and recoup their placement times. And all the plans we've put in place for all the professional groups, nearly, as far as I'm aware, all has been recouped by January, which has been a fantastic effort by the students and by the academic staff within the school, and everyone's now back on track. And the reason why we're now starting to get even better is that the vaccination programme. So as students now restart placements, they're being vaccinated as they start. The Pfizer vaccine is being used for healthcare staff, and it's the Pfizer vaccine that is being given to the students. The AstraZeneca is being used for all the rest of the population, and we've also just signed off on the Moderna, but we're not quite sure which groups that's going to be given to. Lectures still online unless classes category 1 and require practical elements, so the lectures are all being delivered online still and will be for the foreseeable future. But if you have a practical element, and some of our courses do, podiatry, diagnostic radiography, physiotherapy, have real practical elements that need to be done prior to clinical placements in some situations. So they are done, but they're done under very controlled measures. Our class sizes are massively reduced, so we would normally do classes of 14 in diagnostic radiography. We're down to classes of 5 or 6. We all have to be masked, we all have to wear PPE, and the rooms are cleaned twice a day while we're there. We have to put the students in what we call bubbles, so that they are only mixing with the same group of students if they're coming in for practicals. We also offer on-site campus testing for COVID in case there are any issues there, and therefore we know where students are coming from, and if they test positive then they're removed from the placements and removed from practicals as well. Big bonus is that the whole of Northern Ireland expects to have the whole population vaccinated by the end of summer 2020, and thereby we're hoping by next academic year to be starting to come back to some form of face-to-face teaching again, which would be tremendous. And that is our plan. So that there picture is a view taken looking down Belfast Lough. That is the city of Belfast in front of you, looking out, and believe it or not, Scotland is in the very distant horizon there, because it's only 20 miles away, so across the water. So we're getting there. It upset things. We've pulled it all back, and our placements are now back on track and going normally. The big difference is everything's being taught academically, virtually, but hopefully we will reach the end of that very, very soon, and that's how it has impacted Northern Ireland. Thank you.